So my name is Katie Clark. I'm Assistant Professor of Nursing at Augsburg University. Thank you for joining us today, Deb. Before we get started, do you consent to be interviewed and having the interview stored at Augsburg University's library, which will be made available to the public?
Yes, I, Debra Rye, consent.
That's wonderful. Okay, Deb, can you tell us a little bit about yourself?
Oh, okay. I grew up in Albert Lea, Minnesota. Graduated from high school in 71. Went to college at Mankato State until 75, but I didn't graduate. Then I moved back to Albert Lea, tried to get some work, but I didn't. Ended up with a situation in 78 where I moved away from Albert Lea and was up north. I had a situation where in 1989 I found myself staying in a shelter across the street from Central Lutheran Church. At that time, Central had a clothes closet, and the Health Commons hadn't quite started yet. So I wasn't really familiar with the area, but I found myself staying downtown until I found more permanent housing. But this was my first familiarity with Central. And then a few years later, the Health Commons, I think, started, I don't know, it was 91, 92?
92.
But because I had been going to the Monday church service that Central had available for people, I found myself meeting Bev Nielsen. And at the time, the nursing center was located in the basement, and it had two doors, and it was kind of hard. It was I kind of went there because they had some hygiene items, and I had problems with my blood pressure, so it was a good place for me to go to get my blood pressure checked. Okay, so then
Where were you living at that time? Were you living in Minneapolis somewhere?
I was living in Minneapolis, but I had stayed at a shelter for a few, like maybe 3 weeks, but I found housing over on the West Bank in Minneapolis. So I stayed over there for a while, and I didn't really come back over this way while I was living over on the West Bank. And then in that early part of the 90s, I had in and out of the hospital with some mental health issues. And when I had that, sometimes I would lose my housing, and I found myself eventually over in the Stevens community area, which is close to Central. And by that time, Bev, I think I think she retired. She was hanging around for a while, but Ruth and Linda became the new directors. And so I'm trying to figure out when that was.
I think it was like
99, 2001,
yeah.
2000.
Somewhere around there.
Somewhere around that. But I still was connected with the church because of the Monday lunch and the church service, because I really found the church service was something that was appealing to me. They had a minister there was familiar from my hometown, because his wife had grown up near that. So I was kind of connected more to the church part, and slowly then, as these new couple of directors came in, I got to know them. So
What do you remember about Bev? Why did she want to start the Health Commons? Do you remember that at all?
Well, there was some. There was a minister that she was talking to try and find a place where she could have like a walk-in place where you could talk to a nurse. Mm-hmm. And I can't quite, that was so long ago too, I can't quite.
That's all right.
But they came up with a plan, and they got it approved by the Central Council. And so she was able to, I don't know how she raised her money to get, I don't know if that was an issue. But there was some controversy at first to get started. But eventually she got it approved with the help of one of the ministers. don't remember which minister it was. I could see his face, but I don't remember.
That's right. Well, so how is the Health Commons now compared to when it first began?
Oh, when it first began, it was more like you just kind of walk in and get some hygiene, and maybe if there was time, you would get your blood pressure taken. I think she had somebody come to help, like a receptionist type person, and she did keep records. So she kept records. I would say that it was more, well, back then you didn't get to know, I didn't get to know Bev really well, or she didn't get to know me. It was more pick up some hygiene or a pair of socks and go on my way. As she developed her nursing program, I think what happened was there were more nursing students. So when it starts out, it's kind of slow. It's kind of, I don't know how to explain it. It was good. But it was just not as many people involved.
Yeah.
And then as they had the two directors, then they would have maybe a student that was working on their master's or their doctorate degree would maybe stay there longer. So it depends, I mean, I don't know what to say.
Well, no, that's perfect because I mean, there's so much. Like, I feel like some of the numbers, like looking at the numbers from the first year till now, like the first year's numbers compared to now are much smaller, and it was much more white. Where now it's a lot more diverse. So I just see like in the numbers, things have shifted, but I don't have the stories to capture what is behind those numbers, right?
Yeah.
Is that really the reality of what happened, or is that what you saw?
Well, when I first started coming, it was smaller groups, and it was mostly white people. And then I think probably around 92, 93, there was more immigrants that came in. We had a lot more mixture of people coming, and it just kind of grew. So it was more Hispanic and African, primarily Somalian people that would come that we didn't have before. And it just happened to be because they came to Minnesota. And since we were so located centrally, people found out about the free socks and the hygiene and the lunch. So yeah, that was a significant change, and I can't tell you exactly what year because I don't remember, but there was a significant change in immigration in the Twin Cities in the 90s, and that grew. That helped we had more people coming to the church and for the Monday luncheon, and that's what it changed.
Well, yeah, and it seems like the numbers of homeless individuals in Minneapolis has grown as well. Like, as the numbers grew, it kind of follows the trend of, like, what Wilders has seen and all of that, too, from...
As the immigration came, it was harder to find more places to live because there were more people that needed low-income housing or affordable housing, and there just isn't enough of that here. I mean, I don't think there's any new public housing from when I first came here. I think the high rises are the same. I don't think they built any new Minneapolis public housing. I'm pretty sure they haven't, but I might be wrong. There might be little other places, other maybe transitional housing that I know I'm aware because of transitional housing that I ended up in later.
So what keeps you coming back to the Health Commons? Because 1992 till now, that's 25 years.
Yeah, I kept on coming back. I think part of being on disability and not really making very many friends, I developed a rapport with the nurses, and I just kept on coming back because they were nice to me. And sometimes we would go out, like maybe once a week we'd go out for coffee and talk, and she would accompany both Ruth and Linda would sometimes accompany me to doctor's appointments, and it was some support that I didn't have from other people, and it was a good thing. That way she could learn about what it's like to be someone like that I was, marginalized, and she could learn what it was like for me to go through the hoops, like going to the psychologist, going to primary care, going even to a dentist. She's the only one who did that.
When I think, like, for me, a question for you would be, now you're volunteering here, and I hear a lot of people say when you are no longer homeless, it's hard to sometimes go back to be around people who are homeless when you have secure housing. So I just see so much strength in the fact that you come back and volunteer. What?
Well, I don't think of that. People that I've met here, there are still some that I knew when I was homeless. I'm not saying that I'm really close and intimate to a lot of people, but I still care. Just like I know that how hard it is to be outside, or how it's like to not have to go eat a lunch, not making your own lunch. I know what that's like. I understand how that. It's like I know how to hold someone's hand when they're hungry, because I've been hungry. And I still feel in my heart that if there's something that I can do, and then this is a place where I can just be here and see people that I have that might be struggling, and I don't know if I give them much support, but I'm just in there with them because I've been there. That's the way I feel about it.
So if there was something that you could change about the Health Commons now, is there anything that you can think about that you would change?
I think sometimes that we get a lot of people, and I think sometimes there might be people that want to talk one-on-one, and they just don't have enough time because it's just too busy, and there's not enough staff to do that.
And being in the trailer this year has not helped.
And then being in the trailer is not helpful. But all things going to be better when you get the new site done. It's going to be bigger and better.
So you were the founder of the women's group at Central. Can you tell me more about that?
Well, we used to sometimes during the time that the Health Commons was open, I would go in. They had another room, and we'd go sit and talk, especially if there wasn't too many people there. And we had a separate room, so you could have some privacy. That I guess I have to go back and do say, when you want to talk to a staff person or a nurse or something, you don't get as much privacy as you think, and that I guess that would be the one big thing. Mm-hmm. There was that room that we could go and sit and talk, and then I said, I mean, it took a long time for me to get to know, and Ruth and Linda and whoever. There was June was there and Martha was there. It takes a while to develop a relationship, and if but regardless of that, there needed to be a place where I could find a group of people, and I didn't know who they were going to be, but I said to Ruth one day it would be better if we had a group just for women to see how other people are getting along and see if we could have some kind of relationships that are trusting and built on, honesty, and not, like sometimes I'd be on the street and ask somebody, well, where can I, and they wouldn't tell me, or I couldn't find out things that I needed to know. So I believe, I think one of the students was working on a paper, and as she got to know other women, I think that's how it really started, was with Sandy, getting the women to come, and I think that's how it really got developed, because of the graduate student working on meeting other women and getting the time to get together.
Can you tell me what a typical women's group looked like?
They could be. There was all kinds of different people. I mean, there some women would have their come to the church or the health commons or the clothes closet with their friends, or some would come alone, and just all different walks of life, but mostly because we were poor or we were grandparents that needed to help our grandchildren find some clothes and things like that. So there's a lot of, I mean, some women might have lived on North Minneapolis, didn't matter where, but I think we came because there was the clothing available and the nursing available. And so, I don't know. I don't know what else to say. I can't think.
When we had bus cards, it was very well attended, and it's been a little less attended the last 2 years, but we'll start again in the new space.
I think it would be good. It's just, when it first started, there was some groups that had been coming, and not just, to the health commons, but we've gotten to know each other in the church thing or in the Monday service. Mm-hmm. And we had developed friendships through that by having lunch together, eating together. And so that just kind of carried over into when the health commons decided to do the women's group. Just kind of, there were some women already there that just came, So and then some people have moved out of state, and, not everybody stays around.
Right.
So now it's trying to get that, I don't really know how
to get that core group,
to get that core group
back
again. I think maybe the bus card had something to do with it, but also there was women that had been coming here on a regular basis, and we all just decided to come to the women's group. I think starting another group up would be a great idea.
So how have the students have been incorporated from the start? How do you see the students contributing to the health commons? Besides, creating the women's group, but how about when we're open on a regular day? Do you see the students as helping, and is this vital to their education?
Well, it's different for each student because they might be from Rochester and they might not have any familiarity with, well, I don't know how to say this. It depends upon the student's background, and I've noticed that some students, not very many, but will walk out of here and say, I'm never coming back here again. I don't want to say that. It's just that the familiarity with, I'm a poor person, and that might, I don't know what it's like to be well-to-do. And if I was even middle income, I don't know what that's like. I'm poor. And so I might swear more. I might not have a nice haircut. I might not wear makeup. I might look different to someone that comes from middle class or up, I might, I don't know how to explain it, but if you don't understand mental illness, chemical dependency, and you see someone that comes in staggering, it might be overwhelming. So on a very rare occasion, a student might walk out. I've seen it a couple of times, but mostly, in most cases, the students are eager to learn and are curious, and once they get adjusted to the environment, everything's fine. Because people like to listen, and it goes both ways.
So if you were to give any advice to nurses taking care of people in the hospital or working in the ERs or anything like that, what suggestions would you have for people to be able to connect to somebody who might be homeless or have mental illness or any of those things? What should nurses know?
Well, the main thing is you need to listen to people. But if I come in there, if I was intoxicated, I don't know how I would react, because you need to take appropriate means to calm somebody down. So I don't know what a nursing role does for that. Because that's different. Because I could even me, I could swing at somebody and not know it because I'm too wasted, didn't know, and I don't want to be restrained. I don't think anybody wants to be restrained, but when you're out of control or if you're having a psychotic break, I don't know how, I don't know what personally how you're trained to deal with that. But when someone comes in and they're sober and they're been on the street, haven't had any sleep for a few nights, or hungry, I don't know, the main thing is to listen to people and trying to figure out what their needs are at the time. I don't, sometimes I would end up in the hospital, but not everybody's gonna be have the need to be in the hospital. So I guess having the resources or the know-how, where can you put somebody, what shelter can they go to because they don't have a place to sleep. I mean, you can't use the hospital as a shelter. So I mean, I know some people go to the ER when they're just too cold and have nowhere else to go. So having the knowledge of where the resources are, I suppose nurses know that now, but some people just get escorted out the grounds, but you're not. Well, that's all I know.
Well, and then I know that you talked about lack of affordable housing being an issue, which is very well documented as a problem in the city for sure, and the county and the state. But if there was one thing that people should really work on around homelessness, do you have an idea of what, from your perspective, what would that be? What do people need who are experiencing homelessness or extreme poverty?
I had to use transitional housing. The waiting list for public housing, I don't even think they're taking names. So transitional housing can be a possibility, but here again, it's still the same thing. Where are they going to have it? Who's, what landlord's going to allow some of his units used for transitional housing? I don't know. It's a big deal. There is no solution. As long, I know people that have 2-3 jobs and they still can't find affordable housing. That's a big thing.
One other question: as a woman who's experienced homelessness or living in extreme poverty, what has that been like? Because I've heard people say that it's a lot different for women to experience that than men.
Well, I remember, where can I go to the bathroom? That was a big deal. Or if I had my period, I don't have any Tampax. Where can I get some of them? But of course, the main thing was not being sexually abused on the street, not being. That was a big deal. Trying to stay sober, because being outside, being homeless, it's very difficult. I didn't have money, so then I'm going from one place for breakfast, another place for lunch, and that's how it's set up. You can go, keep you moving around. That's how the city does it. Keep you moving around from place to get another meal. But you're so vulnerable, because I'm sure there's guys that just drive around that area because you're so. Somebody say, you want a pack of cigarettes, or it's just bad. It's not safe. There's not. I remember trying to avoid somebody and run into a police officer, and the police officer says, well, just keep going with that person. He kept me, just said, just stay with that person. I'm like, oh, great, you can't find any help. So, I gotta stop, because this is too much.
No, it's fine. We also have a graduate student Jenna Nelson here as well. Jenna, do you want to introduce yourself?
No, yep, I'm Jenna.
I should have introduced you at the beginning.
That's okay.
But I just want to make sure that, do you have any questions as far as, or is there anything I'm missing?
No, I can't think of anything. I think it was like the healthcare, like what would you need from like ER nurses or like, and I think you kind of shared that. And then, I don't know, are there any other like services that you found helpful?
There's one thing about ER. A lot of times I have like high blood pressure, but I might not have. I might be without medicine.
Mm-hmm.
So I would have high blood pressures because I wouldn't have my medicine. So that's one of the reasons that I would have to go to the ER, because I would have problems with my heart condition. That's a big deal too. If you're homeless, you might not have your medicine. Or I remember staying at a shelter, and I had to go get verification from the county, and I left my stuff in my room. And when I came back, they had gotten rid of all of it because they had a rule or something. And I'm like, are you kidding me? Like, and that happened to me more on one occasion. You're sent out because they have a rule that you have to get this verification for housing, and then you come back and then all your stuff is gone. So, yeah, being homeless, you lose your stuff a lot. So it's a good thing that Central has closed here, because sometimes you don't have any, or you just got one outfit, or someone will steal your coat. That's another thing. Losing your winter coat. All right.
Did you have anything? What did you say?
So I guess the other question was like, where do you go? Like, I guess what are other places you go to that you have found helpful? So it sounds like the Commons have been helpful. When you started going to this church, shouldn't that seem to help?
Yeah.
Are there any other places?
Then there was a place on Franklin Avenue. It was called Catholic Charities, that was open early in the morning, so you could get some hot cereal. Well, I don't drink coffee, but it was a place to sit if I was out all night. That'd be the first place I would go, because that'd be the first place that was open. And that place and then you got to find a place where you can take a shower, and so there's sharing and caring hands. And there was another place. There was a women's shelter that's not there anymore, but was on Franklin. So sometimes I find myself staying there, but you had to be out at 7 in the morning, and you couldn't come back until 3. But the good thing about that was you could start to rebuild, and you apply for apartments, and then you had a mailing address. That's another thing. Where can people contact you if you're homeless? And I did for a while have a post office box at the main post office in downtown Minneapolis, because I needed to have an address where people could write to me and say my apartment was available. Yeah.
Well, you have such a wealth of knowledge and information and stories, so thank you. Is there anything else you want to add or share? Or I think I asked you all the questions I really had on my agenda.
Okay. I can't think of anything. I hope I gave you some insight on what it's like.
Thank you. So you're done.
You're welcome.